As we age, it's crucial to prioritize the health of our penis and prostate. In this video, we'll explore essential practices to keep these vital parts of the male body in top condition. First and foremost, maintain a healthy diet, rich in fruits, vegetables, and whole grains. This helps to prevent obesity and reduce the risk of prostate issues. Regular exercise is equally important. Aim for at least 150 minutes of moderate aerobic activity per week, such as brisk walking or cycling. Next, prioritize regular prostate screenings. Starting at age 50, discuss with your doctor the benefits and risks of prostate-specific antigen (PSA) testing. Additionally, maintain a healthy weight. Excess body fat, especially around the waist, can increase the risk of prostate cancer and erectile dysfunction. Don't forget about your pelvic floor muscles. Practice Kegel exercises regularly to improve bladder control and sexual function. Stay hydrated by drinking plenty of water throughout the day. Proper hydration supports urinary health and helps flush out toxins from the body. Lastly, prioritize regular sexual activity. It promotes blood flow to the genitals and helps maintain erectile function. Remember, these simple steps can significantly impact your penis and prostate health as you age. Implement them into your routine for a healthier, happier life. If you found this video helpful, don't forget to like and subscribe for more valuable tips on men's health. And as always, take care of yourself.